want to show you a few like key websites that people use often that we think will be useful in your work. Just a few tips, like this is not a major focus of the presentation, but how you can use data. This is if you're describing data for a grant, just sort of basics, like it's important to describe the baseline numbers, which are not just like the percent of children, but giving absolute numbers can be really helpful. And then also the rates or the percentages if you can, like 1 per 100 adults or that sort of thing. Trends are also useful to grant makers, like so they could see, especially if you have like 2, 3, or 4 points in time, they could see how things have changed over time and whether like a situation with 1 year is unusual or just sort of like the normal part of the trend, like the rate's been the same every year for a long time, or if this year is an unusual year. And then using area comparisons or benchmarks, like you can compare cities or towns to other cities that are similar. If you're using counties, you can compare, like if you have county level data, you can compare counties to each other, or metropolitan areas, those are similar. And then adding like the statewide rate if you can, just again sort of as a benchmark so you can help describe the information and people can put it in more context. And these are a couple examples, like if you're writing out a grant, you could say 18% of adults. It's helpful to say who you're talking about. So instead of just saying 18% of people, if the data is about adults, it's helpful to say 18% of adults, and then comparing it to the statewide rate. That would be, this is actual data from the Community Wellbeing Survey that we do. And then the, another one is to show the percentages and the numbers if you have them. So both, in this case, the second example shows both. This is the Data Haven website, and you can see on most of the pages there's this Ask Mark button that takes you to like a form you can fill out with some questions. And then the first example on your handout, I think, is the Community Wellbeing Survey. So you can access that through like the reports page on our website. If you click on reports, you'll see some featured ones like the Community Index we just passed around, the Immigration Report. And if you scroll down, there are other reports here. The Wellbeing Survey is a page in the report section, for example. So this is just kind of a landing page that tells you about the survey, how it was done, and gives you links to results. So this is one way to find the information. If you wanted estimates for the whole state, the link is there, and you can download that. And it gives you this document, which it's designed for like printing out and reading. It's very small text, but it gives you every question on the survey and the percentage of adults in each category. So that would be like one way to do that. People like to print these out and just sort of have them as a reference. Or you can use it online. So that's for Connecticut, and then for other geographical areas, you could also search, using this search tool. It gives you all the different estimates. So if you were interested in Ansonia, for example, you could click on the drop down on the right that says data types, communities. If you clicked on communities and selected Ansonia, it would give you just the data sets that have like Ansonia data in them. So in this case, you have like a data set for crosstabs, which are those like very dense document for the whole valley region, and then also for just the town of Ansonia. And then yeah. So this is a search feature like within the Community Wellbeing Survey page. That it's like a typical website search, but it's automatically populated. So it gives you data for other geographical areas here, and you could click there and access all the documents. This is if you're interested in like the reports and the documents. Another way to find that more generally is we have a data resources page. So if you're on our main site, there's the reports menu at the top. There's also a data menu, and the first selection there is for resources, which gives you like all the kind of documents and single data sets that we have, including maps. And here you can also do a search. You can type in Ansonia, for example, into the search box, and you'd get again those examples, and you could kind of filter out documents or just data related to the Wellbeing Survey, which is what the previous search was. That would give you this menu. So that just shows you where the survey data is. One thing that's easiest to use on the Data Haven site is under this data menu. It's called Communities, and this is a page with community and neighborhood profiles. So this is giving like highlights of data for a specific town or area. And again, if you were interested in Ansonia, you could select from this list of towns. We have it broken down here. You could see all the towns in the state and find your town. Or you can just select like a large town. We made that easier to find. So there's some different profiles here. And what those look like, if you select Ansonia, for example, it gives you some highlights from the Community Wellbeing Survey. Like it's just a few data points. It's not trying to overwhelm you with a million data points, but it gives you some key facts from that survey. And then also some key facts from the census. So again, the census gives you like about 3 million possible data points. So you don't want to look at that, but if you're just interested in some key factors, so one is demographics, that would be like total population. Here it's using the most recent data from the census, and it gives you the population of Ansonia versus the state, population of children, and the percentage, seniors, and men versus women. There's some other issues from the census that we pulled out. We were trying to limit it. There's obviously a lot more that could be found from the census, but we limited it to some here that we get requests for most often. So one is like the poverty and low income rate, which I think is a question on the Community Foundation's application. And this gives you the rates for total population. So the total population for that poverty status is determined for, and then the population in poverty is the second number there. And then the low income population is the population that's earning less than twice the poverty limit, federal poverty limit. So those are all defined in the data here. If you're not familiar with like what indicator to use because you haven't worked with the data, that's a common challenge. You know, people who are writing grants for the first time are not familiar with what data is out there. So one way to look at that is to see, to talk with the Community Foundation and see like what people have reported in the past. They ask those questions like for a reason. They want the low income rate, I think, typically, because that's what grantees have used in the past, so they can explain what that is, or in one of our reports we explain what that is, or you can use, there's many other sites out there like Kids Count from the Annie Casey Foundation, or other sites that explain what each of those indicators mean. So before you start looking for data, sometimes it helps to know, that you're looking for some specific indicators, or do it both ways. So that gives you a sense of this this profile page. And these are for all the towns, and there's a profile page for the state and the region. So that's like what we think is, and this is based on talking with other folks around the country, what we think is like most easy for people to use. They just want like a limited number of data and to find it for a town. And that, for that reason, that's why it looks so simple, in other words, relative to some of the other stuff on here. I think also on the worksheet you have, there's a link to the data dashboard. And this is also on this data menu. So resources was like the link to all the documents. Communities are these profile pages. And then the dashboard is like a new feature that gives you some more like interactive measures. So typically in the past, we've looked at these as, we've published these as printed documents so people can use them on paper, which is how most people prefer, we think, to work with data. But we've also been putting them online. So if you click on the neighborhood data viewers, for example, on the dashboard, there's like an interactive map that gives you rates for neighborhoods within the city or other cities around the state. And this shows you, the rates for like New Hallville, Prospect Hill, East Rock. These are like the neighborhoods, how the city defines them. And you can see the rates show up on the dots on the right, but also on the map. So there's some fun, if you're already familiar with using like data websites, there's some fun features on here you can kind of play around with. And this shows you like a bar chart, for example, of the poverty rates. So in this case, it's ranked by low income rate. So like the Hill neighborhood has the highest rate of families earning less than twice the poverty rate, and like Westville and East Shore, the rates you can see are much lower. So it gives you an understanding of different communities in the city. on those measures. There's also this map actually shows the high income rate, so the families who are earning like 5 times the poverty level or above are what the shading represents here. So there's some features on the data dashboard, and then I'm going to go back. So the handout that you have, it gives you some places where to look for. So I covered the well-being survey. There's a description of what's in there, the community profiles, data resources, the Ask Mark button. These are basically the site. It's kind of contained in that sense. And the reports page gives you all the downloadable, like the PDF files, like the report I passed around. You can download those from the reports page. Oh, yeah, that reminds me. There was one area I didn't cover. So this is described on the sheet too, but there's this Knowledge Center page that we haven't really added. We haven't moved everything over to it from like the old version of the website. But there's a data guide on here that has like links to different like additional resources. So if you go to the data guide for childhood and education, for example, you'll see like we try to keep these links updated. The reason we did this is more for our use. Like these are sites we go to often to get data from the state government or from federal source. So at the top you'll see EdSite, which is a site I'll show. This is the State Department of Education's website. So if you go to these data guides, sometimes you'll find some other links in there. But like I said, there's literally like tens of thousands of these sites out there now. So so the link's actually on the handout that you have. It's under like other like state sources, but we also we try to keep the links on our page, like these data guides. So there's a guide like for other issues as well. But I wanted to point that out. So there's a lot on here. Sometimes it's like hidden, especially with the reports and the data resources. Like you'll find reports from organizations, going back like 10 or 20 years. So sometimes you'll find some interesting reports like from the 1990s or 10 years ago about a specific issue that's still very relevant to work today. All right, I'll switch over to the census website, which is definitely the resource we use most. There are a couple like key census sources that are very widely used, and one is the decennial census. This is the census every 10 years where they literally count everyone, and they, it's very intensive. They have to hire millions of people to do it. It's, like I said, it's every 10 years, so that's called the decennial census, and that gives you a count of people like for every block in the city. They use that for voting districts and things. The other source is called what was called the long form survey on the census. It's now called the American Community Survey. And they used to do that also every 10 years along with the full count. And it's a survey, so they didn't interview everyone. They interviewed like 1 out of every 6 or 7 people in a neighborhood. And now instead of doing that, they are doing the survey constantly. So any time of year you might get the survey. It's just done every month around the country. And they interview like several million people, I think, per year. So it's over a 5-year period. They're still interviewing about 1 out of every 7 people or so. But it's stretched out over 5 years, so they're collecting data like continuously. And that replaced the long form that they used to do. And what the American Community Survey asks are, the decennial census really just asks like how many people live in your house, and whether they have one question about whether you own your home. And they ask about your race, ethnicity, and age. But the American Community Survey is a much longer survey. Probably some of you have taken it recently. It's like asks about your income and car ownership and health insurance and sort of other issues. So the American Community Survey is like the biggest local level data collection that we do, and it provides a lot of our statistics for projects. So the American Community Survey and the census you can get from the Fact Finder website. You can get some other census surveys as well. The census does like about 130 different surveys of the country. So they measure things like, I forget, literacy I think is one of the surveys. There's crime. There's surveys about crime and a whole bunch of other things. Economic data, if you're interested in like town economic business development, that sort of thing. There's measures of that on here. But it's you can usually find more information on the census website. Oftentimes, like you'll have a research question about literacy or incarceration or something like that, and the standard data sets that we collect like for all neighborhoods won't cover that topic. but they're national sources that really have for many years tried to understand like how conditions are changing for, for another topic. Like there's early childhood surveys, there are many health surveys, so you can track those issues that just don't fit into the census, but they're still just as important to track, like healthcare quality and around pretty much any topic that anyone is interested in. There's probably some kind of survey out there. So we've looked at a lot in developing our survey for the state. We looked at a lot of those existing surveys, so we could choose what we thought would be most useful for local level. So, like our survey, we have questions about, walking and parks and bicycling and safety in neighborhoods. Those are issues that like people talk about a lot in Connecticut, but there's not like a survey that would be providing data at that level. So there, in many cases there are, and you can, even if you don't have the local data, you can still cite national data on topics to give you a sense of like key issues around your issue area. So there's some different ways to use this fact finder page. One is just to type in a city or state. So you could type in Ansonia, and it kind of automatically knows which Ansonia you're talking about. But in some cases, it will give you a menu of other. There might be like many towns named Ansonia, and you'd have to choose one. So New Haven, there are many New Havens, and the drop-down is only giving you a few examples. So if you just press enter, it gives you New Haven County as a default. So if that's not what you were looking for, you could click see more results, and you'd have these other New Havens around the United States, and you'd find here's New Haven City or town. In Connecticut, we have the whole state is broken up into 169 towns, but as you know, there are other government entities in the state, so there's some odd places in the state where the town and the city aren't the same thing. I think there's a couple examples around here where like the Milford Center is like its own designated area by the census, but it's different from the Milford town. So just be careful. The best, if you're just interested in town, using the town is the best way to go. But again, you could usually look that up. So this gives you the data for New Haven town, which is the same as the city, and gives you like population, and then you could click through for some other key indicators. Like often people are interested in these sorts of demographic factors, and if you click on that, you'll get like a breakdown by age, for example. So that's what they call like the quick facts search. There are other things like that on the census website where you can just sort of type in a geography and it gives you like quick facts about it, kind of like our community profile. It's sometimes like a little more detailed than you might want, but that's a good place to look. And then the advanced search is like finding more data sets. Once you select data, there's buttons here to download if you missed that. So you could work with it, as a document or an Excel file. So going to the advanced search, usually this will be empty, and you'll have to select geographies. And this is where instead of looking at one geography, like if you wanted to compare 20 towns, you could select all 20 towns through this menu. So usually first you'd select your geographies of interest. Like you might select, the 20 towns in the region that you serve. And then after you do that, I'll just show you how to do that really quick. So if you go to the list in Connecticut, the census calls the towns county subdivisions since the county's like fully divided. So you'd select county subdivision, and then you could select all the county subdivisions like within New Haven County, for example. So I'll add that as an example. So you'll see kind of like a shopping basket, like the selection at the top left. That's giving you the geography selection. So it's all the towns in New Haven County selected right now, and then these are the available data sets. Right now it's showing there are probably like thousands of those, so you could start filtering it down to topics. So if you were interested in like health insurance, you'd look, there are topics related to housing, topics related to people. You could look up like income or employment, health insurance, So if you selected health insurance under there, it'd give you all the data sets related to health insurance, and then the year that they were from. So you can also, if you wanted, you could add a filter for the year or the type of data set. With the American Community Survey, in Connecticut, we almost always use the 5-year estimates. You'll see on the right, there's a 5-year and a 1-year estimate. The 1-year estimate is fine for some things. It's based on the data collected within any 1 year from that survey. But the 5-year data is a much larger sample. It's 5 times larger, so the accuracy of it is higher, especially when you're working like at a town or a neighborhood level. In many cases, the data won't be available from the 1-year estimate for like a town or a neighborhood. So just by default, we use the 5-year sample. It's just much larger and more likely to be accurate, especially for areas of less than 1 million people or so. So once you have the data sets filtered here, you can select a table. These are all tables here, or data sets, and they have the S tables are like the summary tables that give you kind of the big picture view, and then the other tables are more specific. So this table, for example, gives you health insurance coverage for gender and age group. And you can see how this is broken down, men and women, and then for different age groups, under 6 to 17, et cetera. And it's giving you the number of people with health coverage. Actually, with and without here. So it shows you for New Haven, there are 5,000. I'll use a better age. So for young adults, 18 to 24, there are like 10,000 people in New Haven in that age group, and then about 7,900 have health insurance, and 2,460 don't have health insurance. So you could use that as a data point in a grant application, for example, if you're interested in getting health insurance coverage for young adults. And again, right now it's showing, the reason it's just showing New Haven and Waterbury is because I selected the table for the 1-year estimate, and it's only available for New Haven and Waterbury. It's not available for the smaller towns. But if I had selected the 5-year estimate, it would have given all the towns in the state. So that's this table. The census is trying to be helpful by, there's a lot of data here, but they're trying to be helpful by giving you like a star at the top, and those are like the fields they recommend. So this would be the 5-year estimate for that same table. And if you click that, you'll see all the towns in this data set with the margins of error. So Ansonia is the first one, and for Ansonia, it's like a similar ratio of the 800 or so young adults, there's about 600 with health insurance, about 140 without health insurance. So this is really useful because there's no other survey in the country that's like even close to this in terms of like the quality of information at a local level, and also the range of topics that are, again, they're very much like related to material hardships or assets that like households have, but it's very, if you've ever seen the survey, it's a very, very long survey, and you can start to compare variables like health insurance versus income, or health insurance versus home ownership, or things. And that type of data could help you target like a population that you serve better. And also the census has been going on for many years, so in some cases you could create trends over like several decades from that data. So I'll go back to the Fact Finder page. And this main census site too has they're always adding, every month they sort of add new features too, so it's a fun, if you're just sort of interested in exploring what's out there, there's a lot of new data every month. There are also videos on the census website that walk you through how to use the system. So like their webinars, if you're interested in watching a webinar for an hour, there's a very detailed webinar. You can learn a lot about it, or there's sort of shorter videos for just kind of like what I just did, like walking through a few steps. And then, let's see, the next site. So there are also many state agencies, and much of the data we collect is at a town or a state level. So depending on what you're interested in, like if you're interested in public health, the State Department of Public Health, they have a home page, and there's a statistics button right on the landing page on the left side, and they'll show you data on all these issues that are not necessarily collected at a federal level, but they're available for like all the towns or areas in the state. So if you're interested in birth outcomes, there's a maternal child health section that gives you kind of different reports. And these are also like, some of these can be pretty overwhelming. Like you'll get a spreadsheet with like 15 different tabs in it, and birth outcome data might be broken down for like many factors, like whether mothers were smoking during pregnancy, teen births, those sorts of issues are all kind of captured in the state reports. The one that we think people use more often is the State Department of Education website, which is data related to all the individual public schools and public school districts in the state. And the state captures like quite a bit of information there about things like testing, student homelessness, kind of a wide variety of issues that are measured at the school level. So you can find various reports here, on this website. And in the interest to give you more time to like do the hands-on work, I'm going to not go through this, but every agency really has a statistics center that is good to become familiar with if you're working in that area. So I listed just a few here on this handout.